history of medicine has a somewhat checkered past. From its earliest history until just before the beginning of the 20th century, many of the earliest practitioners were only able to provide the crudest forms of medical assistance to patients. For years, spiritual healing, bloodletting, and herbal remedies were generally the only form of medical help available to the average person. But this began to change in the late 1800s as advancements in medical practices began to move at a rapid pace. Perhaps one of the most important advancements during that time was the development of the X-ray in 1895. With this device, doctors finally had the ability to peer inside the human body without having to perform surgery. Since that time, this unique machine has proven to be invaluable, allowing doctors a two-dimensional view inside of the patient. Although this technology has been a revolution, the two-dimensional pictures were not appropriate for all types of soft tissue imaging, such as those used in cancer diagnosis and in heart procedures. So,
what is MRI? MRI stands for Magnetic Resonance Imaging, and for the next few minutes, we'll discuss the MRI examination. What makes MRI so different from other medical imaging techniques, such as conventional X-rays and computed tomography, known as CT scans? And under what circumstances is MRI the preferred imaging technique? Let's see. X-ray devices are generally used to take projection images of hard tissues like bones. CT scans take images of both hard bony tissues and soft tissue, such as the brain. Both X-ray and CT systems use X-ray beams, which travel through the body and project an image onto a photographic film or displayed on a video monitor. MRI, on the other hand, works differently. MRI uses a magnetic field to orient the position of certain nuclei in the body. A radio wave is then used to excite the proton, which resonate and emit varying signals, which are received, digitized, and displayed as images. Different signals emitted by different body tissues are then used to differentiate individual anatomy. When tissue is damaged, its composition changes and gives off an uncharacteristic signal. So when displayed, that damaged tissue is distinguishable from surrounding healthy tissue. Once again, it's important to point out that MRI utilizes magnetic fields and radio waves. Patients are not exposed to X-rays or other ionizing radiation. You'll see some of the remarkable images produced by this type of medical imaging exam. These are MR images of the brain. They're astoundingly clear and detailed.
The heart is a beating muscle that pumps oxygen and nutrient-rich blood throughout the body. Each beat is stimulated by electrical signals that pass through the heart muscle or myocardium. In order to examine the function of the heart, a doctor may perform a test called an electrocardiogram or ECG, also referred to as an EKG. During this test, electrodes are placed on the chest and recordings are then made of the heart's electrical signals. Sometimes the electrodes are also placed on the arms and legs. The electrical signals follow a set pathway through the heart, beginning at a spot called the SA node, which is located in the top right chamber or atrium. The signal then branches out through both the right and left atria, which contract and push blood into the lower chambers or ventricles. The electrical signal also passes into the ventricles via the AV node, and then travels down the tissue that separates these two lower chambers. Finally, the signal travels back up the ventricles, which contract and pump blood to the lungs and body. Variations from the normal electrical pattern may indicate damage to the heart due to a heart attack or heart disease. Often a patient will be required to perform a stress test during an ECG. A stress test usually involves walking or running on a treadmill at progressively increasing intensities while recording an ECG. This test allows the doctor to examine the heart's electrical activity during the stress of exercise.
Hi, my name is Andy Lee, and today I'll be talking about the life support decision. Back in 2005, there was this very famous case in the U.S. Regarding Terri Schiavo, and it was a very important decision because she was on life support for about 15 years, and in the end, her husband wanted to take her off the life support, although her parents went against that. After many trials, the case finally got to the U.S. Supreme Court, and then President Bush also stepped in and came up with a decision. But in the end, her husband did take her off the life support. Now, I think that the decision should be first made by the person, the patient, him or herself. But in the case of Terri Schiavo, she was unconscious. She couldn't make the decision, so the next step would be her guardian, and in her case, it was her husband. So the next logical step would be to ask the closest other family member to make the decision. Now, sometimes it's very difficult to make a decision, so many people take it to the court, and you have to abide by the state laws. So that's my opinion on life support.
Our knowledge of DNA is also rapidly growing. It allows us to better understand the causes of certain diseases and to make treatment more target-orientated. In the future, we will even be able to predict certain diseases and prevent them from happening at all by personalized treatment. For various conditions, this preventative type of medicine will make an enormous difference to our healthcare. A disease is often caused by certain defects in proteins. Our proteins are controlled by our DNA sequence. The use of a DNA chip is based on our knowledge of the human genome. It simultaneously checks the sequence of thousands of genes and creates a sample sheet of your DNA. This will allow researchers to predict whether a drug will or won't work for you. Doctors will increasingly use DNA chips to examine their patients to come to a much simpler, quicker, and more precise diagnosis. DNA chips allow doctors to categorize people who apparently have the same condition into different groups. Every group is then allocated the drug with the best effect or the highest success rate. This categorization leads to a better understanding of the disease and the development of made-to-measure drugs, which could pave the way for selective, preventative, and personalized treatment. The final result: more quality of life.